Hello, guys. VT International Academy, one of leading academy in training nurses in the nursing competitive exam as well as IELTS and NCLEX and OET training. And today, Magic Pill session, we are going to discuss very important topic, that is simplified psychiatry. I'm going to discuss the basic and mental status examination in important points only. Okay, so the important aspect in a simplified way, I'm going to explain to you. So definitely here we am going to concentrate more on the vital points instead of questions. Okay, so let's begin the session. So actually this is the part 1. Okay, part 2 session is also there. So it will be released soon. Within 1 or 2 days, I will be releasing that also. Okay. With the important quote, motivational quote, let's begin the session. Success is never permanent and failure is never final. Okay, so keep on motivate yourself. Do your hard work as well as smart work. So definitely your success is very nearby. Okay, so with these quotes, let's begin the session. So as I mentioned already, we are going to start with the mental status examination in specific, vital points and MCQ point we are going to discuss. So let's start with the basics. See, if you take psychiatry, the two things are very, very important. The basic two things are very important. The first one is mood and effect. Mood and effect. Okay. So hereby, I have explained very clearly in a simplified way with the examples. I'm going to explain each and everything to you. So watch the video till the end. Definitely it will be so much useful for you. And if you like the video, please like it, share it, and subscribe the channel so that it will motivate us to post more and more videos. So mood and effect. So mood, what is the meaning of mood? It is a persistent and pervasive feeling. Okay, what is mood? It is persistent and pervasive. Actually, mood means it is an internal feeling. The basic difference between the mood and affect you have to understand. See, mood means it is an internal feeling and affect means it is an external feeling. That is, others can observe you and they can understand in what feeling you are in. For example, if you are in very happy, you used to laugh, right? And others, those who are observing you, they can say he is a happy person, he is laughing now, his mood is happy. Okay, so that is called as what? Affect. What others are seeing your expressions, from your expressions. Okay, so mood means internal, affect means external. This is what I want to say. This is the first golden point. Okay, mood means internal feeling, affect means external feeling. And the mood, it is classified into two things, that is persistent and pervasive. Okay, to be simple, persistent means even in the morning, in the evening, in the night time, every time the patient or the person, they will be having the same feeling. For example, if he is happy means happy, if he is sad means sad. Okay, so that is called as what? Persistent. Persistent means continuously he is having the same emotion. Okay, so that is the first important point. The second one is pervasive. Pervasive in the sense the emotional state in most of the places. For example, if he is going to the office, if he is going to the market, or if he is staying in the home, whatever it is, doesn't matter, his emotional state is going to be same. Emotional state is going to be same. Okay, so that is called as what? Pervasive. Persistent means continuously in the same emotional state, and pervasive means wherever he goes, there also he is expressing or he is having the same emotion. Okay, so on the whole, the mood means what? It is an internal feeling, and the affect means what? It is an external. Okay, external means you are expressing. Okay, guys, so you can see here the meaning of affect, expressions of the emotions, and it is observed by the others. Observed by the others. That is called as what? Affect. Okay, guys, in the mood, it is simplified into persistent and pervasive, right? The same way in the affect also, it is classified into many effect, like labile effect, flat effect, inappropriate effect. We are going to discuss each and every one with the example, so watch continuously. Okay, so the next slide, what we are going to see is the classification of the affect. Different types of examples of affect. Okay, so affect. The first affect what we are going to see is flat affect. FLAT, flat affect. It is also called as blunt affect. Flat affect or blunt affect. Okay, in a simplified way, I have given the meaning for this. See, when discussing the happy or sad event with the patient, you are discussing a happy event or a sad event with the patient will not give any kind of expressions. Any kind of expressions. Okay, even in Parkinson disease, the patient will be having, the same kind of flat affect. There will not be any expressions. Same way for this kind of schizophrenic patients, they will be having what? Flat affect. If you are discussing happy moments with the patient, or if you are discussing sad moment with the patient, there is no expressions will be there from the patient side. Okay, so this is called as what? Flat affect. It is also called as blunt affect, commonly seen in schizophrenia. Commonly seen in the schizophrenia. Okay, so the first one is over. The second one is labile affect. We are discussing the different types of examples of affect. Okay, the second topic what we are going to discuss in the affect is labile affect. L-A-B-I-L-E, labile affect. See, rapid and apparent change in the emotion without any stimuli or without any reason. All these points are key points, guys. Please make a note of it. Okay, simplified key points. Okay, so rapid and apparent change in the emotion without any reason or without any stimuli. Suddenly they will laugh. Suddenly they will be in the happy mood, and sometimes they will be in the sad mood. Okay, abrupt change, abrupt ups and downs. Okay, so that is called as what? Labile affect. It is seen in manic patients. You know, manic in the sense bipolar disorder. Sometimes they will be in depressive state. Sometimes they will be in elated mood. That is very happy. Okay, and also this kind of labile affect commonly experienced from organic mental disorder patient. For example, the best example of organic mental disorder is schizophrenia. See, what is, so not schizophrenia, Alzheimer's disease. What is that? Alzheimer's disease. See, what is organic mental disorder? The person is having some medical problems. Okay, so some problem in the brain, medical problem in the brain. I will give you an example like Alzheimer's disease. Okay, so because of that particular problem, he is expressing some psychiatric signs and symptoms. Okay, so that is called as what? Organic mental disorder. So why I am explaining this? See, labile affect, it is seen in mania most commonly and also in the organic mental disorders. Clear, guys? So in mood, we have seen pervasive, persistent, and in affect, we are discussing flat affect over, labile affect over, and the next affect what we are going to see is inappropriate affect. What is that inappropriate affect? Affect not matching with the situation. Affect is not at all matching with the situation. I have given the example also, you can see very clearly. Laughing in the funeral of your family members. Usually in the funeral, what we will do, we used to cry or we used to express the sad face, right? But here, even the death of the family person is there, but still the patient is laughing in the funeral. Funeral of your family members, the patient is laughing. Okay, it is inappropriate to the situation, right? Yes, for one more example I can give. He is watching a comedy movie and he is crying. Anyone will cry by watching the comedy movie? No, but still, here, this type of expression is taking place, means this is called as what? Inappropriate affect. Okay, the next one is incongruent affect. Incongruent affect. Here, the affect is not at all matching with the mood and thought. This is the key point. Affect is not at all matching with the mood. Affect means what? Expressions. Mood means internal feeling. Okay, so the expressions are not matching with the internal feeling of the patient. I have given the example. Look at here. See, asking the patient, how is your mood? As if physician or therapist, you are asking to the patient, how is your mood? And the patient replies that by laughing, the patient is replying, I am very sad. Okay, so laughing is an expression, laughing is an affect. Okay, and very sad is the internal feeling. Okay, so laughing and sad both are opposite to each other, right? So that's why I'm saying affect is just opposite to the mood. Okay, so this is seen in what? Congruent affect. Okay, and most commonly this type of congruent affect is present in schizophrenic patients. Okay, guys. So far we discussed about what? The basics of the psychiatry, that is mood and affect. Now we are going to start with a very vital points commonly asked in the examination, that is, mental status examination. The questions you can expect very commonly from the mental status examinations. Okay, if you take mental status examination, especially for assessing the thought process. Okay, so here it is mentioned. So especially if you are assessing the thought process, it is classified or categorized into 4 parts. The thought process assessment in mental status examination is classified into 4 parts. Mostly, if they are asking questions from mental status examination, from this area only, they can ask the questions. Okay, so as I mentioned already, thought process, it is classified into 4 parts. What are all the 4 parts? You can see I have given everything in the tabular column. The first one is flow and stream. These are all the category of the thought process. Okay, the first category is flow and stream. Second one is content. Third one is form. Fourth one is possession. Okay, flow, it is also called as stream. Second one is content. Third one is form. Fourth one is possession. So these are all the 4 categories. We are going to discuss one by one in detail. In part 1, especially, we are going to discuss about the content. What we are going to discuss? Content. Okay, and in part 2, I will be posting another video, that is part 2 video of the simplified psychiatry. In that, we are going to discuss about flow, stream, form, and possession. So in this video, we are going to discuss very detailedly the important points about the content. Okay, the second one, content. Okay, let's begin. So content. So before starting about the content, let's start with your brainstorming question. The question is, a person is saying his family members are dying. The person is saying the family members are dying. He is also saying nothing is existing in the world. This question asked in NORCET 2021. Always I used to say that whenever you are reading the question, catch the key points. Find out the key points. Here, what is the key point? Family members are dying, nothing existing in the world. These are all the 2 characteristics. If these 2 characteristics are present, means what is this? What type of delusion is this? This is the question. So here they have given 4 options like delusion of persecution, delusion of reference, delusion of grandiosity, and nihilism. Okay, so if you know the meaning of each and everything, it is easy for you to sort out the answer. And for this question, the right answer is option D, that is delusion of nihilism, and delusion of nihilism is also called as negation. What is that? Negation. Okay, so option D is the right answer. Option D. So let's discuss each and everything so that you can get an idea why I have selected delusion of nihilism. See, in delusion of nihilism, it is also called as negation. The best characteristic feature is the patient used to say that I am dying. The world is not at all existing. My family members are dying. There is nothing, no internal organs present in my body. So these kind of key points are present, or these are all the key points you have to notice if you are coming across the word delusion of nihilism or negations. Okay, so here also you can see these 2 key points, that is family members are dying and the world is not at all existing. So that's make you to bring the answer, that is delusion of nihilism or negations. Okay, so with this, let's start with the thought process second category, that is content. We are going to discuss content in the first part and form, flow, possession in part 2. Okay, so watch that video also. So in content, we are going to discuss different types of delusions, important delusions so far asked in the examinations. Okay guys, the first delusion what I'm going to discuss is, with the example I'm going to explain everything very clearly. Please watch the video, means don't skip the video. Okay, so delusion of persecution is the first one. It is very common delusion. This is the most common delusion. Which is the most common delusion? In the exam you will be getting the questions like this. Which is the very common delusion? Delusion of persecution. Okay, and here I have given the example also. The neighbor is trying to kill me, or someone is going to harm me. These type of key points are present. They are trying to killing me, they are trying to harming me. Okay, this type of key points are present, means that is called as what? Persecution. Delusion of persecution. It is the most common delusion, guys. And the second one is delusion of reference. All these points are already present in all these delusions already asked in the questions. Previous question what we discussed. Okay, so delusion of reference means, again let's start with the example. People are talking about him, spying on him. Okay, so these type of key points are present, means that is called as what? Reference. Some people are talking about the patient, some people are spying on the patient. So these type of words the patient is saying. Okay, like talking about him, people are spying on him, then you have to think about what? Delusion of reference. The next one is delusion of grandiosity. Very commonly asked question is delusion of grandiosity. What is delusion of grandiosity? See, Here, it is very important point because so many times this question asked in the examination. Delusion of grandiosity means false claims. What is that? False claims. See, false claims like I have superpower. I am a very famous person. I am the king. I have vast knowledge in this world. So this kind of statement the patient used to give. So this is called as what? Delusion of grandiosity. Grand. Okay, guys. So this is very important among all delusion. This delusion is very important. So far, so many questions asked in the competitive exam related to delusion of grandiosity. Okay, fine. The next one is delusion of nihilism and negation. See, this is the answer for the question what we discussed earlier, right? So delusion of nihilism, it is also called as negation. What is this? False, fixed, firm belief. The patient is not at all changing his belief. Okay, the fixed belief is present. See, delusion means fixed belief only. Okay, fine. See, here in delusion of nihilism, the patient denies that existence of self. Existence of self. Even he denies the existence of the loved ones, existence of the family members, existence of the world. He used to say that everyone is dead. Even he is dead, everyone is dead, the world doesn't exist. This type of statement is given by the patient means this is called as what? Delusion of nihilism, commonly seen in mania and depression patient. Which patient? Mania and depression. Delusion of nihilism and negation. Both are said. Okay, and one more important key point always you're supposed to remember whenever you are thinking about or discussing about delusion of nihilism and negation. What is that? Cotard syndrome. I have highlighted in green color. Cotard syndrome. What is Cotard syndrome? This Cotard syndrome, it is also having two more other names, that is, Cotard delusion or walking corpse syndrome. Walking corpse syndrome. Here you can see Cotard syndrome, also known as Cotard delusion or walking corpse syndrome. It is a rare mental disorder in which affected person holds the delusional belief that they are dead, they doesn't exist, they lost their blood, and the internal organs also lost. Okay, it is commonly seen in nihilism patient, and this type of statements are given by the patient means this is called as what? Cotard syndrome seen in nihilism. Okay, guys, fine. The next other different types of nihilism so far asked in the competitive exams are as follows. The next one is De-Clerimbert syndrome. De-Clerimbert. Actually, it is Clerimbert. De-Clerimbert syndrome. It is also called as erotomania. I hope this word is very familiar. Okay, because in previous exams they have used the word in the question erotomania. See, erotomania, De-Clerimbert syndrome, or delusion of love, all are same only. All are same. Okay, so let's talk with the example. Here, the patient used to say that a famous actor is in love with the patient. For example, a famous actor like Rajkumar, Kamal Hassan. So these people are in love with the patient. Okay, so these type of key points are present means you have to think about the erotomania. Okay, the next one is Othello syndrome, delusion of infidelity, morbid jealousy. All are same. Okay, so what is this? What is this delusion of infidelity? See, here, let's talk with the example. Examples are always important, guys. Whenever you are discussing any point in the psychiatric point of view, you have to study along with the example for remember everything, because the words are also so it's different. For example, delusion of infidelity, morbid jealousy, erotomania, all these words are new. It's like a neologism. All are very, very new, and whenever you are coming across these kind of new terminologies, you have to study along with the examples. In the exams also, competitive exams also, they will give the examples and they will ask what type of delusion is this, what type of disorder is this. Okay, so now we are going to discuss about what delusion of infidelity. The best example I have given here, the patient thinks that spouse is having another affair, illegal affair. The patient thinks that the spouse means what? The husband is the patient means the husband used to think wife is having the illegal affair. The wife, if the patient is the patient means the wife think that husband is having an illegal affair. Okay, fine. So this is called as what? Morbid jealousy or delusion of infidelity, and commonly seen in alcohol substance abuse. This question also already asked in the exams. Okay, the next one is delusion of misidentification. Delusional misidentification, very important point. This is very important question, guys. Okay, many times this question also asked in the exam. Delusional misidentification. Here, what they are, from the word itself, it is clearly understood that misidentification means not identifying the person correctly. The patient used to think that, for example, close relatives, we can take close relative, wife, we can take wife as a close relative. So the patient thinks that wife as a stranger. The patient thinks the wife as a stranger. And in one more point of view, the patient thinks some stranger as a wife. Let me give the examples. See, I'm talking about what? Delusional misidentification. This delusional misidentification is categorized into two types. The first one is Capgras syndrome and second one is Frigoli syndrome. What is that? Capgras syndrome and Frigoli syndrome. Capgras syndrome means the close person is replaced by the stranger. Underline the word, the closed person. The close person is replaced by the stranger. Okay, let me talk with the example. Here you can see the example very clearly. Mr. X is admitted in the hospital. His wife coming to meet him. Understand the point of view. Okay, X is admitted in the hospital and his wife is coming to meet him. But the patient says the patient says to his wife, "You are not at all my wife. You are a hospital staff." The patient is saying to his wife, "You are not my wife. You are the hospital staff. You are a stranger." Okay, so that's why I said that close person is replaced as a stranger. This word you please keep in mind. In Capgras syndrome, close person is replaced by the stranger. Okay, and Frigoli syndrome is just opposite to that. Here, the stranger is replaced by as a closed person. The stranger is replaced as what? Closed person. You can see with the example, patient says, patient says to the stranger, "You are my wife." The patient is, for example, the patient is admitted in the hospital, the doctor is or the nursing officer is coming and meeting the patient, and the patient says, "You are not a nursing officer, you are not a hospital staff, you are my wife. You are my wife." To a stranger, the patient is saying, "You are my wife." Okay, this is called as what? Frigoli syndrome, just opposite to the Capgras syndrome. Capgras syndrome, close person is replaced as a stranger. Frigoli syndrome, the stranger is replaced as a closed person. Finish. Next, delusion of infestation, parasitosis, egg-borne syndrome. Very important. Already they asked question related to egg-borne syndrome. Okay, all these three things are same. Delusion of infestation, parasitosis, egg-borne syndrome, three are same. Okay, so what is this? The patient says that there are some insects present inside the body. Patient is not saying something is moving in the body. It is called as tactile. It is not present here. The patient verbally says that some insects are present inside the body. That's all. Okay, so this type of words the patient is expressing means it is called as what? Delusion of infestation or delusion of parasitosis or egg-borne syndrome. Okay, guys. So far we discussed about what? Content. In thought process. In mental status examination, we discussed the thought process. In thought process, the second thought process, the content is completed. The rest, what all the things are there? Form is there, possession is there, flow of thought is there. So those three things will be covered in the next video. Hope everyone understand the concept. If you have any doubts anywhere, you can drop your message in there or doubts in the comment section. And if you like the video, please like it, share it, and subscribe the channel. It will motivate us to post more and more videos, guys. Okay, thank you very much.